Hello, my friend. I'm Dr. Linda Parker, and for many years I've dedicated my work to helping older adults protect their brain, their heart, and their independence for as long as possible. Today I want to talk to you about something that, honest to say, hardly anyone explains well: the harmless painkiller that so many seniors take every day, and how it can quietly increase the risk of stroke when it's used in the wrong way, at the wrong time, or in the wrong person. For decades, we've been told a simple story: if a medication is sold without a prescription, it must be safe. Those little pills for joint pain, back pain, or headaches seem like no big deal. You take one, the pain goes down, and life continues. But once you cross 60, 70, or 80 years of age, your body plays by otras reglas, very different rules, and that no big deal pill can have consequences that nobody warned you about. When I say harmless painkiller, I'm not talking about a single brand. I'm talking about an entire family of medications called non-steroidal anti-inflammatory drugs, or NSAIDs. This group includes common drugs like ibuprofen, naproxen, diclofenac, and several others. They're used to bring down pain, inflammation, and fever. Many of them are available over the counter. Others are given on prescription, often for arthritis, back pain, muscle aches, or injuries. Because they are so familiar, people start to believe they are almost like candy. But especially for seniors, they are powerful drugs that deserve serious respect. Let's slow down and understand what's really going on in your body. A stroke happens when part of the brain suddenly stops receiving the blood and oxygen it needs to function. Sometimes that's because a blood vessel gets blocked by a clot. That's called an ischemic stroke. Other times, a vessel in the brain bursts and bleeds. That's called a hemorrhagic stroke. In both cases, brain cells begin to die within minutes. Depending on the area affected, a person can lose strength on one side, have trouble speaking, lose vision, feel very dizzy, or develop a sudden severe headache that feels not like any other headache before. Now here comes the part most people never hear. NSAIDs work by blocking certain enzymes in the body that are involved in producing substances called prostaglandins. These prostaglandins are involved in pain and inflammation. So when you block them, you often feel better. The swelling goes down, the joint moves a bit easier, the back feels less stiff. The catch is that prostaglandins don't only deal with pain. They also help protect the lining of your blood vessels, regulate blood flow to the kidneys, influence how your blood clots, and even affect your blood pressure. When you keep those enzymes blocked day after day, week after week, year after year, you're not just calming pain. You're also subtly changing how your circulation, your heart, and your brain are being protected. For a younger person with flexible arteries, strong kidneys, and no chronic illness, that extra risk may be small and temporary. But imagine those same effects in a 70-year-old who already has high blood pressure, slightly stiff arteries, maybe some plaque in their neck arteries, a heart that has worked for decades, and kidneys that are not as efficient as they used to be. In that landscape, the impact of the harmless painkiller is very different. Blood pressure may creep up. The body may retain more fluid. The heart works harder. Blood may become a little more likely to form clots. No single pill is a catastrophe, but the daily habit can become a quiet force pushing the system toward a dangerous event. To make this more concrete, let me introduce you to someone like Robert. Robert is 74. He has had high blood pressure for 20 years, takes medication for it, and his cholesterol is a bit high. His knees hurt because of arthritis, and he wants to keep walking, gardening, and staying independent. One day a friend says, "Take these pills, I use them all the time." They're over the counter, no problem. Robert starts with one tablet occasionally. Then the pain gets worse, and one tablet becomes two. Soon he is taking them almost every day for months. He doesn't mention it to his doctor because he thinks, if it were dangerous, they wouldn't sell it without a prescription. Meanwhile, his blood pressure readings inch up. His ankles are mildly swollen. He feels more tired. He blames it on age, not realizing that his daily painkiller is putting extra pressure on his heart and his brain. Now, imagine a different person, Susan, 69, also with arthritis pain. She too wants to stay active and independent. But before taking anything regularly, she sits down with her healthcare provider and says, "These are the pills I'm using. Are they safe for someone my age with my medical history?" Together, they look at her blood pressure, her kidney function, her other medications, and her past history. Maybe her doctor suggests using the NSAID at the lowest possible dose, only on the worst days, and combining it with other tools: physical therapy, gentle exercise, heat and cold, weight management, and a different type of pain relief that may be kinder to her heart and brain. In Susan's case, the painkiller becomes a controlled tool, not an automatic habit. There is another piece that complicates everything for older adults. Most seniors are already taking several prescriptions: tablets for blood pressure, pills for the heart, medicine for diabetes, maybe something for cholesterol, sometimes a blood thinner to prevent clots. NSAIDs can interact with many of these. They can weaken the effect of certain blood pressure medications, leading to higher readings. They can stress the kidneys, especially when combined with diuretics. They can influence how easily the blood clots, which matters a lot when someone already has a risk of stroke or is taking drugs to keep the blood thinner. When all these factors overlap, the overall risk can grow quietly, even though each individual pill seems small. It's important to be very clear. The goal is not to demonize medications or tell you that you must live in pain. Untreated chronic pain also harms your health. It raises stress hormones, disturbs sleep, increases blood pressure, fuels anxiety and depression, and can prevent you from moving your body, which in turn increases stiffness and weakness. My message is not never touch painkillers. My message is, at your age, respect them, use them wisely, and never assume that over-the-counter means risk-free. So what can you do in practical terms to protect yourself? First, look honestly at your current habits. Are you taking a painkiller from the NSAID family every day or almost every day? Have you been doing this for weeks or months without talking about it in your medical visits? If the answer is yes, this is not a reason to panic, but it is a very good reason to bring it up with your doctor. Make a list of what you take, including over-the-counter pills, herbal products, and supplements. Take that list to your next appointment and say, "I want to make sure these are safe for my heart and my brain at my age." That one sentence can change the whole direction of your care. Second, ask about alternatives and combinations. For some people, a different type of pain reliever may be more appropriate for occasional use, especially when the main concern is protecting the heart and brain. For others, using the NSAID only on certain days or for short periods while relying more heavily on non-drug strategies may be the safest plan. It might include strengthening exercises, gentle stretching, water-based activities that are kinder to the joints, or devices like supportive braces and proper footwear that reduce the strain on painful areas. Third, observe your body with curiosity, not fear. If you use these painkillers and notice your ankles swelling more than usual, your blood pressure creeping up, sudden shortness of breath, chest discomfort, or new, strange headaches, don't ignore it. These may be signs that your body is not tolerating the treatment well. And of course, if you ever have sudden weakness on one side of the body, trouble speaking, difficulty understanding words, loss of vision, severe dizziness, or a sudden, extreme headache, treat that as an emergency. Time is brain. Fast action can mean the difference between returning to independence or living with heavy disability. Let me share another example that I've seen repeated in many different lives. A man in his late 70s arrives at a clinic after a minor stroke. During the evaluation, the medical team reviews his long list of medications. Hidden among them is a particular NSAID he has been taking every single day for years for the back. Nobody had really questioned it. He assumed it was safe because he had never had a serious side effect that he could see. When we look closer, we notice his blood pressure has been harder to control over the last few years. His kidney function is lower than before. His heart is more strained. The stroke was not caused by a single factor, but the daily Harmless pill was certainly part of the story. When the medication is adjusted, his blood pressure improves, his swelling decreases, and his overall risk goes down. If I had to summarize the core message in one powerful line, it would be this. At your age, there is no such thing as a completely harmless painkiller. Every pill you take is part of your brain and heart story, so it must be chosen with care. This idea can feel overwhelming at first, but in reality, it is a form of empowerment. It means you are not a passive victim of bad luck or old age. You have influence over the choices that shape your risk of stroke and other serious events. And here comes the hopeful part. It is never too late to review, adjust, and improve. Even if you have been taking the same painkiller for many years, you can still sit down with your doctor and say, I want to make sure this is still the best option for me now. You can still start moving your body in kinder ways, strengthening your muscles, protecting your joints, and improving your circulation. You can still make changes to your daily routine, better hydration, more balanced meals, good quality sleep, quitting smoking if you still smoke, moderating alcohol. That support your blood vessels and your brain. Your brain has an incredible capacity to adapt and protect itself when you give it the right conditions. Your heart can benefit from even small improvements in blood pressure, in weight, in movement. Your blood vessels respond to better habits, less inflammation, and healthier choices. You are not stuck with the risks you had yesterday. Every decision you make about your medications, your habits, and your lifestyle is a chance to move the needle toward greater protection and longevity. So, as we close this conversation, I invite you to do 3 simple things. First, check your home. Look at the labels of the painkillers you keep in your bathroom, bedside table, or kitchen drawer. Learn their names and doses. Second, write those names on a piece of paper or in your phone and bring them to your next medical appointment. Show them to your doctor and ask, calmly and clearly, are these safe for someone like me? Third, consider one small habit you can adopt this week to reduce your future need for pain pills. A daily walk, a set of gentle stretches every morning, a glass of water instead of a sugary drink, or going to bed 30 minutes earlier to support your body's recovery. I'm Dr. Linda Parker, and I want you to remember this. Your age does not make you powerless. It makes you wise. You have lived enough years to know that quick fixes often have hidden prices. From today on, let every pill you take, especially that harmless painkiller, be a conscious choice, not an automatic reflex. Your brain, your heart, and your future self will thank you for it. And if this message resonated with you, share it with someone you love. Sometimes a simple conversation about a small tablet can prevent a very big problem in the years to come.